Hello, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. You know, what if I told you there was one drug that could treat and prevent dozens of diseases? Well, there actually is. Although it's not really a drug, exercise is medicine. And that is our topic today, and here to tell us more is Chip Gay from Mayo Clinic Health System. Chip is a clinical exercise specialist. Chip, thanks for joining us today on Speaking of Health.
You're welcome. Thanks for having me.
Well, exercise, we all know that we should do it, but I don't think a lot of people actually realize what a great benefit exercise actually has for our health.
Yeah, exercise can help your cholesterol, can help your blood pressure, can help you feel good, helps your bone density, may help prevent cancer. Alzheimer's. There's tremendous number of benefits to exercise.
So what is the proper amount of exercise, and what are some good forms of good exercise?
Well, the general guidelines are to get at least 150 minutes in a week of moderate cardiovascular exercise. So that's walking, biking, on level ground, not real vigorous, something that you're just moving around. And so that would be about 30 minutes 5 days a week. For some people that sounds like a lot, but there's 23 and a half hours in the day that we can rest, watch TV, do other things.
And one of the things that I've heard you talk about before is a lot of people spend a lot of time in front of the TV, a lot more than 30 minutes a day, right?
Yep. The average person watches about 1,600 minutes of TV a week. And the exercise guidelines are 150. So if you exercised about 1/10 of what the average American watches TV, you can gain significant health benefits.
You know, when most people think of exercise, they don't think of maybe just simply walking or mowing the lawn or gardening. They think you have to go into the health club, you have to lift weights rigorously, you have to run marathons, that kind of thing. But that's not all what exercise is about.
No, there's tremendous benefits to even low levels of exercise. If you're a person that does very little exercise and you just get up and start moving 10, 15-minute walks a day, most days of the week, you can see some significant health benefits. And if you get over that 150 minutes a week, you'll see a lot of health benefits to that. And you don't have to kill yourself when you exercise.
So how does exercise help our bodies in the treatment and prevention of diseases? You hear from your doctor, you need to exercise more, but how does it actually help your body out health-wise?
Well, I work in cardiac rehab and pulmonary rehab, so that's kind of my area of expertise. As far as your heart goes, your heart's a pump. When you exercise it regularly, it becomes a stronger pump. Exercise also helps the blood vessels inside your heart, so it flows better. Most people have known or have relatives that have had a heart attack. Regular exercise can prevent heart disease if you do a moderate exercise and you stick with it. And it can help keep those arteries clean inside your heart. Now,
besides heart disease, other diseases, we talked about it earlier in the show, other diseases are benefited from exercise, right?
Cancer, especially breast cancer and colon cancer, there's strong evidence that regular exercise helps that. Exercise helps your immune function. And even moderate exercise, it stimulates that immune function. If you're sedentary, your immune function works okay. If you exercise moderately, it goes up. And the interesting thing is if you do real vigorous, real hard exercise, your immune function starts to decline a little bit. So going out and doing a little bit of moderate exercise is very beneficial for your immune function.
How about mental health? Can it benefit that?
Yes. There was a study done on severely depressed people, and they had 3 groups of people. One that took the medicine, one that exercised in medicine, and one that exercised only. After about 4 months, they all got about the same result. But the interesting thing, 10 months after the study started, only 30% of the people that were exercising relapsed into depression, whereas 50% of the people that were taking the medicine relapsed into depression. So this one particular study found that exercise long-term was actually a little bit better than the medicines.
I guess it makes sense. When you exercise, you feel better, you have better self-esteem, and eventually that's going to help your mental health, make you just feel better.
Yep. Older adults that lift weights, that exercise, they feel better about themselves, they have more self-confidence, and if you feel better about yourself, you're going to get out and you're going to do more things.
Now, what about other benefits like orthopedic benefits when it comes to joints, bone, muscle?
Yep. The key if you're starting an exercise and you have some orthopedic issues is to not overdo it. Okay, if you overdo it, you can actually damage yourself. But regular exercise, either strength training or moderate cardiovascular exercise, will actually help strengthen your tendons, your ligaments, your bones, and so it'll actually help you get stronger. And the evidence out there says that it will help reduce pain. So if you have a bad shoulder, if you can get those shoulder muscles stronger, get them in better shape, you're going to have less pain.
How about bone density in women? That's a hot topic, and does
Yep.
exercise help with that?
Yes. It has to be weight-bearing exercise. So riding a bike or swimming is not going to help your bones a lot, but walking is going to strengthen your bones from your waist down, because where there's impact. Okay? The best thing that you can do for bone density is weightlifting and get on a good strength training program. Only needs to be done 2 or 3 times a week, and it has to be a decent amount of weight that's going to put a little stress on your bones that helps them become stronger and maintain or even gain just a little bit of bone density.
How about getting a better good night's sleep? Will exercise benefit that?
Yep. If you get out, and you do the moderate amount of exercise, most people are going to feel better mentally and physically, and it'll help you fall asleep faster and sleep more soundly.
And how about losing weight? A lot of folks out there may want to shed a few extra pounds. Exercise obviously helps in that. How many in relationship to calories burned and the amount of exercise? How does that work?
Every mile you walk, you're going to burn about 100 calories. Every couple miles you bike, you're going to burn about 100 calories. So it doesn't, you walk a mile, 2 miles, 3 miles, that's 300 calories. You get home, you eat a candy bar, you've just wiped out all of that exercise. So exercise can help with weight loss, but if you really are focusing on weight loss, you have to change your diet. One of the Mayo researchers gave a presentation and they talked about if weight loss, 90% of weight loss is diet, 10% is exercise. Once you get down to your ideal weight, 90% is exercise, keeping up that exercise and sticking with it, and then 10% is the diet. So for weight loss, you've got to change your diet. For weight maintenance, exercise. The other interesting thing is that weight loss in our society is very difficult, okay? And we have TV, we have junk food everywhere. It's very difficult for people to lose weight. Even without weight loss, exercising has tremendous health benefits. So even if you are overweight and you start exercising, you can achieve significant health benefits without any weight loss.
So what you're saying is even if you are overweight, you get out there and exercise, you may not be losing weight, but you're actually still helping your body.
Yep, you're helping yourself prevent diabetes if you don't have diabetes, or helping your diabetes, you're helping your blood pressure, your cholesterol. There's many health benefits, even without weight loss.
So I guess the $1 million question is, why aren't more people exercising? If it's this good for you, it's free, why aren't more people exercising?
That's a very individual question. Our society is, we have a lot of TV time. We've already talked about that. We're busy. We don't think we have a lot of free time, and a lot of people just don't like exercise. And they've had bad experiences in the past. They've gone out and done too much, and they're sore for 2 or 3 days. They don't feel good. And that's the key with exercise, Jason, is that the moderate amount of exercise helps you feel good. And so that's if you do decide to go out and start an exercise program, you should feel good when you're done. If you feel exhausted, maybe you did too much. If you don't feel like you did anything, maybe you got to do a little bit more.
And motivation's got to be really key. You have to be motivated to get started, right?
Yep. 81% of Americans, according to a study by the American College of Sports Medicine, want to be healthier. So 4 out of 5 Americans want to be healthier. It's just hard to do it. And one issue is there's a lot of mixed messages out there. We get, one person says you got to do this and one person says you got to do that. And that's one of the things we're really trying to work on in our system is a nice, clean, easy set of guidelines for people to follow. At least 150 minutes of moderate exercise a week. And if you're doing that, try to lift weights at least 2 times a week. Not too difficult to follow. There's no fancy things.
And it probably helps to have a partner too, someone with you that can help you through all that, right?
Yeah. Anytime you can make exercise more enjoyable, you're more likely to stick with it. I work in cardiac and pulmonary rehab. We have classes. Our patients come down, and some of them never want to quit because they like it. They're doing the right amount of exercise. We're getting them feeling good, but they're also socializing with each other. if you can socialize or make your exercise a social event, either with a spouse, kids, pets, they also need exercise. Go join a class. That can really make exercise much more enjoyable. You're more likely to stick with it.
All right, so I want to begin exercising. What is my first step that I need to do to get started?
Get up and start moving. And that's the key is if you're not doing any exercise, maybe just start with a 10-minute walk once or twice a day. Even on your, if you can walk on your lunch hour or after work. It's better to start easy and not overdo it than to do too much. I have a slide in one of my presentations that if you do 1 minute a day, if you started with 1 minute today and you did 2 minutes tomorrow and you added 1 minute every day, in a month you'd be up to 30 minutes. Now, nobody's going to do 1 minute a day, but it really, your body can progress, and it's a very safe, easy way to progress. If you're not doing anything, you're real deconditioned, start with 5 to 10 minutes of walking. If you're in okay shape, maybe 15 to 20 minutes of moderate exercise is okay to start.
Now, should folks, should they talk to their healthcare provider before they begin exercising, or does it depend on your situation?
It depends on your situation. If you're a younger person, you're relatively healthy, you don't have any major health issues, orthopedic issues, diabetes, heart disease, things like that, you can probably start a moderate exercise program on your own. If you have a strong family history of heart disease, you've had some diabetes or some other health issues, you might want to talk to your doctor or healthcare provider before starting an exercise program.
What about age, Chip? Are you ever too young or too old to exercise?
No. Kids can start moving. When you're young children, they don't need formal exercise. They just need to move, get out and play and things like that. Just get out and do stuff. As far as older adults, you're never too old to exercise. I've started patients and I do some strength training out of my house, and I've started people well into their 80s on weightlifting programs, and they've gotten really good results. So, and there's research that says even people in nursing homes, 75 to 99 years old, start a weightlifting program, they can get stronger. So you're never too old to improve. You're not going to get the response like you did when you're 20 if you're 80 years old, but you can still see significant health improvements, no matter what age, and even if you've never exercised your whole life.
Now, what about here in Minnesota, in the winter, people would think, well, there's less chance to get out and exercise because the weather's cold, it's snowy, it's icy, I can't go out and walk and do some of the things that you talked about. But there are other opportunities, right?
Yep. Joining a health club, going walking at a mall or a school gym or any place indoors, getting a treadmill or a bike at home as a backup exercise for you is a great idea. And winter is actually a great time to get out and exercise. When you're exercising, you're burning calories, you're generating heat. And your body, when you're generating that heat, you actually stay warm. And so if you're cold and you go out and exercise, you actually may help you get warm. And so it's a great time. Winter activities, cross-country skiing, downhill skiing, walking outside. If it's icy, wear those little cleats on your shoes. It's a great time to get out and exercise. And the other thing, we talked about immune function earlier. Cold and flu season is during the winter. Well, if you're doing moderate exercise throughout the winter, that's going to stimulate your immune function, and you're less likely to develop upper respiratory infections, those colds and flus that most people get.
In this day and age, too, we have such technology to help people exercise. I know there are now apps for your phone, and there's probably all kinds of information out there on the internet, and those kind of tools can be useful too, right?
Yep. There's very simple tools like a pedometer that you can wear, and it tells you how many steps you take a day. There's accelerometers that tell you movement and tell you how many calories you burn and how much you've moved throughout the day. There's apps. If you have a smartphone, you can get apps on a phone that'll tell you if you went for a walk, how far, how much you went up and down, your speed that you walked at. If you're one of those type of people that likes that data, that feedback, that can be a great thing. You don't need that. You just need to get out and move and do a little bit more and more each day, but that really can motivate some people.
All right. Well, unfortunately, we're all out of time. A great topic, though. I'd like to thank our guest today, Chip Gay, clinical exercise specialist from Mayo Clinic Health System. A great topic. Thanks for joining us.
Yeah, thanks for having me.
Have a great day, everyone, and be healthy.